Hello, today I just want to talk to you about resuscitating the hyperthermic patient. These patients present to us with really high body temperatures and they need prompt recognition and urgent resuscitation because this is a time-critical illness that needs our prompt intervention in order to prevent them from having multi-organ failure. So we're going to look at a case here. So this is a 70-year-old female. She was found by paramedics to be quite confused with an altered conscious state, sitting in her car on a hot day. When they got to her skin was very red and erythermic. She was hot to touch and she was quite dry. They found her heart rate to be quite tachycardic at 132 beats. Her respiratory rate was 22. She was saturating well at 100. Blood pressure was a little bit saggy, 97/60, and she had a temperature of 40.9, which is quite high. So when we look at hypothermia, the causes that we need to actually think about, and they can be a multitude of causes. So we can see it from the toxicological side of things, so patients that can present hypothermic with serotonin syndrome, neuroleptic malignant syndrome, malignant hypothermia, sympathomimetic toxicity. There's some CNS infection type causes, so meningitis, encephalitis, or you can have hyperthalamic disease as well. Remember, your hypothalamus sets your temperature regulation for your body. There's also some endocrinology causes, so things like thyroid storm and adrenal causes. Sepsis and fever, going with sepsis, can prevent hypothermic and result in multi-organ failure as well. You can get a mixture of the above. And the other big one that we see, certainly in the southern hemisphere as we're heading into summer months, is environmental causes of hypothermia. And so with our ambient temperatures outside and patients exposed to those ambient temperatures in perilous situations that they may find themselves in, can result in hypothermia. And the thing with hypothermia that we're worried about is this is a time-sensitive critical illness that does result in multi-organ failure. And we define it as heat stroke, and this is where there's a core body temperature above 40 degrees. And the signs that we're really worried about is if they've got an altered GCS, they present having seizures, or they present in a coma. And so once we've promptly recognized these patients as having heat stroke, we need to intervene quite quickly. And so the way that we can treat the hypothermic patient is we want to get all their clothing off and all the sheets off them and expose them to the ambient temperatures within our resuscitation bays. We want to implement continuous temperature monitoring, so that can be esophageal if they're intubated, or it can be rectally, or there are some skin temperature monitoring that does do continuous temperature monitoring. We want to fluid resuscitate these, and this is where it's a good idea to keep cold fluids within your pharmacy fridge, within your emergency department. We can try an evaporative cooling technique, so this is where we can use fans, we can use mists or ice packs to their groin and axilla. But the gold standard for actually rapidly cooling these patients is cold water immersion. And the reason we do cold water immersion is we want to prevent multi-organ failure from occurring. So the cold water immersion, the approach is the safest way to do this is to place a body bag underneath the patient, or you can have it on the bed if you've got pre-notification that this patient's coming in. You're going to then place the patient inside the body bag. It's safe to attach monitoring. If you're worried about electrocution to yourself or to the patients, then you can just have them on end-tidal CO2. You can have an arm outside the bed and just have a blood pressure cuff and saturations on there. You want to then fill the actual body bag with ice and water directly onto their skin, and this causes like an ice water slurry that rapidly cools these patients quite quickly and quite aggressively. And we leave them in this cold water immersion, you can see it there in the pictures, for about 10 to 15 minutes. We're going to have core temperature monitoring going the whole time, and once we get their core temperature down below 38.5 or their GCS starts to normalize, that's when it's time to actually remove them from this cold water immersion. Okay, so you're going to need a team approach to actually get them out of the body bag. You're going to need a tri-trolley available next to it, and the safest way is just to have multiple staff there available, lots of towels to dry them off. You can actually get most of the ice water slurry to go down to the bottom of the body bag, and then roll it out from underneath them, and then just dry them off. And then you can transfer them onto a dry trolley that way. So it's the quickest and most effective way to rapidly cool these patients. If you're worried about the safety concerns, this was an article that was published earlier this year in the Annals of Emergency Medicine, and they actually did synchronized cardioversion for a patient that was in ventricular tachycardia while they're actually in cold water immersion. And it was safe for the patient, and it was also safe for the staff. It's a really interesting case, and it's worth having a read of. So the take-home points I want to leave you with when we're looking at the hyperthermic patient is, for those of us in the southern hemisphere, hotter weather is just around the corner, and we are going to see these patients present to our emergency department, so we need to be prepared for them. We want to recognize the patient. There's a risk of multi-organ dysfunction, so anyone with a temperature above 40 degrees is going to need cold water immersion to rapidly cool them and to protect those organs. Okay, so have an approach and have a plan. Think about simulating this for your patients for when they come in next. Thanks, everyone.